you want to do that. So I have my nice little cotton ball. Squeeze it out, please. Let's not try to drown the patient. And we're going to clean the nares. Now I'm going to show you how to use it with, just clean out. We don't want you to do a dig down in there too much and cause them to have further problems. Okay, so you can clean the nares this way. And things may come out and dried mucus. You know exactly what I'm talking about. So, you just throw that in the trash, okay? And so, I need some KY jelly too, guys. Somebody go over to the stacks and get me some KY jelly. Okay? Now, I am ready to do what?
Change the tape.
Change my tape, okay? So, to change my tape, I don't know what all this is that somebody used. This is a whole lot of strip of tape here, which makes it really hard to come off. And you can't use your scissors. I know you want to take out your scissors and cut the tube by mistake, but no, we're not doing that, so don't try it. And I need some tincture of benzoin as well. So I'm going to hold this in place. Once you have released that tape from around it, you're never going to turn this loose. If you do, that constitutes a failure. So don't do that. Now,
repeat that.
I said, do not release the tube because it is taped in at a certain position. And if you release it, it could go further in or come out, and that's not what we want. Do not release the tubing. Notice I'm still holding the tubing. If you see me turn the tubing loose, I'm going to fail. Oh, well, let that stay on. Notice how I'm coming back and forth. Am I putting my hand all in the patient's face like this? No. I'm holding there. You're going to say, excuse me. I'm going to clean this area here. And look, someone put some tincture of benzoin on, and they did not clean it. So come look. See where it's turned the mannequin brown? So we want to clean that off. And how you defat that is with acetone and alcohol, or just with some alcohol, and it takes it right off. Let's see your hand now. You don't even know which hand you had it in. Look at you. See, it's all gone. Okay, so I would put tincture of benzoin down here. Now open that up for me, please. Read the directions. It tells you where to tear. What does it say? Thank you. Look at that. Oh, that's scary. She tore it up. Is it working? Is that one any good? Let's get another one. Come on, let's throw this out. How about y'all tearing where they have the notches and the indicators and it says tear here? Let's not try to reopen or open things according to our dictates.
Pull upright, tear.
Oh, that's what it says?
Yes, ma'am.
Oh, well, let's do that. Sometime today. I'm on the clock here. Excuse me, are you holding on to that?
Alcohol, please, so you can put some extra pressure on it.
Well, why didn't you do that? That's what I wanted you to do. Okay. So I'm going to put this here, and we're going to get that off when we get through. And it makes you, the patient kind of says, ooh. Okay? And we want that to dry. And while I'm waiting on that to dry, I'm going to clean the rest of this tubing the way I want it to be cleaned. Okay? And I've already cleaned the nares, and I'm going to take my KY jelly. Where's my KY jelly? Okay, open that up for me. And I would have opened all this stuff when I first started. Open it across. Thank you. Well, it is something special. We don't want you to make a mess with this, okay? I'm going to put this on my what? Pinky finger, and I'm going to put this up in the nares. Okay, so I want to lubricate my nares. Oxygen is very drying. Oh, you knew that? Okay, and then dry on the outside so I can stick my tape on pretty well. Okay, now, I'm hoping that my tincture of benzoin is nice and tacky. Yes, it is. And I'm going to put my underwear down. You don't have to use the tincture, by the way. It's up to you. But this is long term. I want it to stay. Okay? Then I'm going to put on my pants. put the gloves on. So you have to practice using tape with gloves on. And I'm going to put that on top of my... Somebody just called me? What's the problem?
I know you're not supposed to let go, but
No,